Okay. Y'all ready? Yes. Okay, good afternoon. We have some very good news about our vaccine efforts in our state of Washington. And before we get to that, I wanted to make a few comments about the education of our children, which is certainly of great importance to the whole state. And I'm pleased to say I've been seeing some great efforts by our educational community, both on-site and remote learning, educators who are being as innovative as possible. And I'm pleased also to say that now more than half of our schools have returned on-site instruction in our elementary school, which I think is a good thing. Roughly half of the elementary school students in our state are currently back in the classroom where they can receive on-site instruction with their excellent educators and their staff. I think this is great progress for two reasons. Number one, we all understand that in-person learning is the best environment for students. It is the best environment to have that magic relationship with their teachers that means so much to them. And second, we know that in-person learning can be accomplished across our state with safety when we use the protocols that we know that work in the state of Washington. Now, how do we know that on-site learning can be done safely? It is because on-site learning is being done safely across the state of Washington. I have been doing a tour, as you know, of schools across the state, and I've seen repeated instances where schools have figured out a way and educators have worked together to find a way to educate our children on-site. And that is all kinds of schools, in urban schools and rural schools, in the east and western part of our state, in schools where I've seen where 32 different languages are spoken, in schools where there are much less dual language learners, in schools that have large communities of color, up 60% communities of color, and those who do not have that type of diversity. In schools of areas that have old buildings and new buildings and everything in between. Our educational community has shown us that they can do this job on site, and that is good news. And now that we know this, it is reasonable to expect, and we do expect, that schools will provide on-site options for parents and students in the near future. Because even without having our school staff vaccinated, we know that we can get this job done. And we now know that in the upcoming weeks, our educators will have options to become vaccinated. So we know that this can be done. We want to thank everybody in their efforts to work together to get this job done. It's the best thing for our students, and I think the whole community at large. With that, I wanted to have a couple other leaders address this issue. Seattle Mayor Jenny Durkin and Senator Reuven Carlisle. Mayor, could you make a few comments?
Thank you very much, Governor, and it's really not it's been a year. In this type
Madam Mayor,
listening to the scientists and the public health experts.
Madam Mayor, can we pause just for a minute? Yeah. We're having some difficulty hearing you. I don't know if your video's on, but could you start again? We'll try another time.
Sure.
Go ahead, that sounds better.
All right. I just said, Governor, thank you for having me here today. It's an honor to be with you and Senator Carlisle. It's hard to believe it's been a year. But during this entire crisis, your leadership has been invaluable to the city of Seattle and the whole state. And I think together, our North Star really has been listening to the scientists and the public health experts. 1 year later, we've shown that our collective efforts have worked. They've taken an enormous toll. I've sat with so many families who've lost loved ones, lost their jobs, lost their businesses, but they continue to do what we ask of them. And as we have this hope on the horizon of vaccines, I agree with you so much that we've got to find a way to get our kids back in school. We're fortunate in Seattle because people have sacrificed so much and have listened to the guidance that we have the lowest cases and hospitalizations of any major city in America, even though we were the initial epicenter with no guidebook. And this pandemic, though, has really exacerbated every single one of our social inequities. And that includes the opportunity gap in our low-income students and throughout our state, but particularly here in the city of Seattle. We are really hoping that we can reopen schools so that we can get the support that we know our students need. You know, as you know, Governor, my first job out of college was a high school teacher for 2 years. And one of my nieces is teaching now back in the classroom recently. And she's talked about how the faces of the children and the ability for them to get back together with their peers in the classroom, be with their teacher, has helped them so much, because we know that this has been hard on the kids. It's been enormously hard on the parents. We know it's really challenged our teachers themselves to try to connect with their students. And we also know that the levels of depression and anxiety and stress in our young people has been very extreme. And we also know that not having the in-class education really sets our kids back, particularly our kids of color who are already struggling with the opportunity gap here in our Seattle schools. Every month they're not in school jeopardizes their future. We are at the next moment of reopening our region and including our child care facilities. As part of phase 2, we've seen a safe reopening of more of our businesses, but we're keeping a close eye on it. The CDC has recommended that we can reopen and remain for in-person instruction, especially in regions like ours where we have been taking the guidance so clearly, and we'll continue to do that in the schools. They've issued guidance and said schools should be the first to open, and K through 12 schools should be the last thing that we close if we have another uptick. We know that families, teachers, children all want our schools to open, and I'm really hoping we can do so safely and soon. Our local public health experts here in Seattle-King County have said they can reopen safely if they use the proper guidance. We've been having and operating child care centers throughout this. Since the beginning of the pandemic, city-operated child care and many of the providers that we fund have remained open safely throughout this pandemic. We also opened teenage hubs for our teenagers in schools who wouldn't have other ways to get together with peers, mentors, tutors, and learning. And our programs are serving 1,200 students in childcare programs, and our teen learning hubs have over 200 students. I also just want to tip my hat to the city workers who've been showing up every day throughout this pandemic on the front lines, making sure that we can provide the services we need, and the child care operators who've also taken in child care, which has been so fundamental for our healthcare workers, for our frontline workers, for our city workers who need that child care to do their jobs. We know that early learning is so critical for educational equity. In our Seattle preschool program, 74% of the students are students of color. Nothing during this pandemic has been easy, but nothing has probably weighed on our hearts and minds more than the struggles our families are having. And among those is the impact this will have on our children and their futures going forward. But I'm really happy, Governor, that we look like vaccination is on the horizon. As you know, the city of Seattle has been working hard with your Department of Health and King County Public Health, and the efforts we've done to really fill that gap in equity has paid off. 70% of our doses have gone to BIPOC communities that otherwise would have been left behind, our BIPOC elders and those over 65. And in the coming weeks, we'll be vaccinating as many people as we can. And of course, as soon as we have enough vaccine, now that teachers are eligible, we hope to have and assist with the state and other efforts to vaccinate our teachers. And King County has surpassed 50% of the 65 and over people have been vaccinated. And we will continue to assist in that program. We know that the supply has been so frustrating to everyone, but we will get more soon. And I'm very excited that Johnson & Johnson gives us a third safe alternative. I'm very proud to report that we did a test of our Lumen facility and that we will be able to vaccinate, we think, 4,000 people per week. And at full capacity, maybe as many as 20,000 or more. If we get the vaccines, we'll get it done. In closing, I know that we've asked a tremendous amount of all of our essential workers. The next thing up is vaccinations. That is our road to recovery. But we know we have to get those students back in the classrooms to operate safely. Schools are doing it. And I look forward to that happening here in the city of Seattle as soon as possible. Thank you, Governor.
Thank you, and thank the city of Seattle, what they've done educationally. My dad taught at Garfield and South. Trudy and I went to Ingram High School, and we look forward to good things happening in Seattle. By the way, you said something, Mayor, that provoked a thought, and that is the fact that we need to follow safe protocols in these schools, obviously, to do this. And the thing that's impressive to me is in 1,000, I think it's over 400 schools in the state of Washington, educators, staff have figured out a way to have those protocols that have been super successful in having this best kind of education and minimal in-school transmission. We know this can be done because educators have been so disciplined and innovative and have worked hard to make sure that we do this safely. So thanks a lot. With that, we have Senator Carlisle.
How you doing, Governor? Thanks
Good.
so much. You know, I really appreciate the opportunity to be with you briefly. You know, I think the mayor is exactly right on every level, and I think it also opens the door to a deeper conversation about just a moment of grace and humility and gratitude for what our teachers and our parents and our kids have gone through. We've all gone through it as a community, but our numbers are moving in the right direction. I think this decision that has been made to move forward actively and aggressively with eligibility for teachers opens the door for us to put on the table that we can be both deeply and passionately committed, as you have been from day one, to science and to evidence and to public health and to data and to following evidence-based best practices from around the world, and at the same time be deeply respectful of teachers and their rights to bargain, their rights to representation, and their rights to their own public health. And now we reach a critical tipping point that I think all of this comes together, that there is an acknowledgement that we can move forward and we can responsibly and carefully get our kids back in schools in a way that works for teachers, first and foremost, that works for families. And I think that this is bringing it together. So I just so appreciate your willingness to really be bold and step up and find a way, as we've struggled with availability. As the mayor said, we'll get it going. But following best practices is not inconsistent with moving forward in our schools. And I also just want to say that, you know, we have a part-time citizen legislature that's working 18, 20-hour days on a big agenda for the people of this state. And of course, it's driven by COVID. It's driven by trying to get our schools open. It's driven by crafting a budget. And it's driven by rebuilding, and that means climate action, and that means a transportation package, and that means a responsible budget that supports the behavioral health needs of the people of our state that have been so impacted. So much of the work of the public's part-time citizen legislature is embracing the absolute priorities of our 39 counties and cities across, of course, across the state. So I just really appreciate the leadership in stepping up to this. The people of the state are so hungry to get our kids back in school, and every one of us, top to bottom, wants to do it in a responsible way. And I think we're showing that it can be done. We're figuring out those best practices, not just from around our state, but really from around the country. So thanks so much, and I just really appreciate this progress we're making.
Thanks, Senator. Thanks for the work you're doing on all these issues. You said something I might take a little issue with, though. You described our leadership as bold. I'm not sure it's really bold, because I think what Washingtonians are really asking is simply for us to do the things that we know that work. And fortunately, we know what those things are because it is being done in, you know, over 1,000 schools today. So I think what I hope we will all ask ourselves, how can we put those things to work for us across the state so that parents have options to have on-site instruction or remote instruction, so that all corners can be happy about the instruction of their children. If we do that, I'm convinced really good things are going to happen in the state of Washington. Thanks, Madam Mayor and Senator. Now I'm going to turn to some discussion of our vaccine program. Really good news in this regard. The pace of our vaccination program and availability are both on an upswing. We are averaging, over a 7-day average now, 43,764 doses every day. More than 1.7 million doses have been administered in the state of Washington. And we've had 2 days during the last week where we actually exceeded 60,000 doses a day. To put that in context, when we started this, we were doing about 13,000 doses a day. So this has been a remarkable acceleration of our vaccination program. I had a really joyous morning this morning in Puyallup, where at a max vaccination site, due to the extreme innovation of people in Puyallup and other places, they're now doing over 2,500 vaccinations a day. And importantly, they've told me today they have the capacity to quite easily go up another 1,000 in a similar type of site. I met some amazing people out there, nurses, assistants, volunteers, physicians. I met a woman named Sherry Bevington, and she had a story. It was pretty inspiring. She fell ill, I believe it was in April of COVID. She was very seriously ill. She was in a hospital for 11 days, but she pulled back. And now she is essentially coordinating the volunteer program for this and other vaccination opportunities, which to me is pretty inspiring because I saw literally hundreds of volunteers doing the traffic control, registration process, helping people. And that volunteer effort is really heartening to me because I know it speaks to the dedication of Washingtonians to help their communities. So I got to make her Washingtonian of the Day because of her inspiration. And I know that her work is going to leverage lots of volunteer hours in the months to come as we continue to expand these vaccination efforts. I feel incredibly touched by this miracle myself. Trudy and I have been vaccinated, and we're so happy that people are now making available 3 different vaccines, all of which are hugely effective preventing hospitalizations and death. And the thought that we will continue saving lives as we have, probably 11,000 lives we've saved because we've been effective and science-based, and we continually to save lives. So I'm very excited about this. So today, because of these efforts and because the supply is increasing, we got some really good news about vaccine eligibility. On our current trajectory, we expect that on March 22nd, a little less than 3 weeks from today, we will enter our second tier of Phase 1B. We are also expanding who will be eligible in this next round. That will include critical workers who work in certain congregate settings will be eligible come March 22nd if our plans come to pass. This again assumes that supplies will increase on the trajectory that we have plans to accept. So this group of people are folks who work in agriculture, food processing, grocery stores, public transit, firefighters, law enforcement, as well as workers in corrections, prisons, jails, or detention centers. Being available to expand to this next tranche of people is really great news in my view. Now, in that same tier, we will include people over the age of 16 who are pregnant or have a disability that puts them at high risk. And I will remind you, of course, that certain child care workers and K through 12 staff, of course, are now eligible today based on the Biden administration's directive a couple days ago. So moving forward, I just want to talk to you about the plans after that. So beginning in mid-April, we expect to make additional individuals eligible for the vaccine. By April 12th, we hope that people who are 50 years and older who have 2 or more comorbidities will be eligible for the vaccine. 2 weeks later, on April 26th, people who are 16 or older and have 1 comorbidity will be eligible. Comorbidities are certain underlying medical conditions like heart disease, cancer, diabetes, which could make someone more vulnerable to complications from COVID-19. You can go to the CDC website to look to the description of those comorbidities and apply it to your individual situation. That same day, April 26th, we hope that people living in congregate settings will also become eligible. This includes people living in correctional facilities, group homes for people with disabilities, people experiencing homelessness, who live in or have access to services in congregate settings. Now again, these dates, of course, have to be tentative, and expanding eligibility will depend on supply and our progress in vaccinating earlier groups. But I have to tell you, I am thrilled at the progress that our federal government is making in combination with these manufacturers to increase supplies. I had a discussion with the CEO of Pfizer day before yesterday, who gave us high confidence that these supplies will continue to increase. So what we've done today, we believe these steps are going to make this vaccine much more available for Washingtonians, and we were thrilled by this information. With that, I'd like to turn this over to Dr. SHAH.
Thank you, Governor. Thank you for your opening remarks and your continued leadership. I just want to underscore a few points, and I think it's really critical as we continue to move forward with vaccines that we remind everybody the incredible progress that we have made. I know you have talked about the numbers of vaccines that we're administering on a daily basis, and also reminding everybody on just how we now have 3 fantastic, effective, and safe vaccines, with now the addition of the Johnson & Johnson one-dose vaccine. And so we're very pleased to see that, and that vaccine is now starting to come into the state of Washington. And so now we have 3 vaccines that Washingtonians can avail themselves of. And then early in January, we were, our every vaccine numbers that were coming in were not as high as we wanted them to be. And so, January 3rd at 29%, and now we're well close to, and many times exceeded, that 80% mark of vaccines that are coming into the state that are being administered to Washingtonians. I think it's important for us to remember that I look at this as a 3-legged stool of vaccine supply, vaccine logistics and administration, as well as vaccine demand. And really, there are going to be times where the supply is limited and the demand is high, which is really where we are now. And there will be times where the supply increases and the logistics become the challenge. And then later on, there will be times where we see that supply is plentiful, but the demand is not as much. And what we want to do is to even that out as best we can. The only constant is that we will continue to be evolving as the situation within those 3-legged stool, each of those legs evolves, we continue to evolve with it. I want to also underscore, Governor, what you just said, which is partners, our community members on the ground, everybody has been really just fantastic at doing all the work to make sure we get vaccines, not just into the arms of Washingtonians, but to also patiently wait their turns, as we know that it has been a challenge at the beginning of this entire process. We've also heard from our partners that they wanted information about what is the look ahead. When does it appear that we're going to be able to move from 1B1, which is, again, seniors, moving to now the addition of educators, and then moving to 1B2, which are the groupings that you talked about. And I want to just say that it's absolutely critical that as we continue to move in this direction, that we think about why we're making these decisions. And as you know, that we've been working on these logistics and the feedback with our communities for months and months, and our internal plans at the state level, but also working with our local partners. And one of the biggest concerns that we have, and the reason why we want to continue to vaccinate seniors, is that we know that seniors are at risk if they get infected with COVID-19 for a serious illness and or complication. And we want to make sure we do everything we can to continue to protect them. At the same time, as we move into those working in congregate settings, we really recognize, we absolutely recognize the importance of exposure risk. And our data across the state as well as across the country tells us that these workers, these essential workers, are more likely to be exposed because of their everyday functions about putting the groceries on the shelves, or driving the bus, or doing all sorts of different activities that they are doing to help all of us be able to do and get our work done, that exposes them and certainly makes them at risk for getting or becoming sick. The other thing that the governor mentioned, I want to also underscore, is that people who are women who are pregnant or others who have certain disabilities, that's also been a consideration based on increased risk. We know these two groups as well can face severe illness or complications if they're infected with COVID-19. And finally, as the governor mentioned, the CDC has for months had a release of information related to those chronic health conditions, what we call comorbidities, that put somebody at risk, and whether that's cancer or chronic lung disease like COPD, heart conditions, type 2 diabetes, of course, pregnancy. These are a few examples, and I want to make sure that we underscore, again, that we're trying to do everything we can to protect individuals from not just getting infected or exposed, but certainly if certain individuals are exposed or infected, that they are more likely to have an adverse outcome, and that's the reason to go in the order that we're going. I want to make it clear that as we're advancing to this next level, in a few weeks, we are not leaving anyone behind. If you're already eligible for vaccine, you remain eligible for vaccine, and that's our health workers. That includes those in long-term care facilities. That includes our seniors above the age of 65, those in multi-generational households above the age of 50, and certainly educators as well. Those individuals remain eligible for vaccines, and today's announcements do not change that. But we do want to continue to ask for patience from our community members, from everyone who's about to go into the next phase of eligibility. While it may be your turn soon, and we're very excited about being able to move from 1B1 to 1B2, you may not be able to get your appointment immediately. So we do want you to exercise some patience as we continue to move forward. And again, as the reminder, as we increase our vaccine supply. I just want to close by saying we will get there, and we're going to get there together. We absolutely recognize the importance of working together, working with our partners on the ground. We want to thank them for the incredible work that they have done. We also want to frankly say that we have heard you and we are supporting you. We're doing everything we can to work with you in preventing illness, hospitalization, and death. And certainly I want to continue to emphasize for our seniors, it is absolutely critical to all of us at Department of Health that our seniors continue to seek vaccine, and they do everything they can to get vaccine, but our providers also continue to make sure that vaccine appointments are available for seniors in our state. And so with that, I just want to say, just a reminder, we have variants in our state. We want to do everything we can with these variants for virus, that we need to continue to wear our mask and make sure that we wear our mask tightly and appropriately and over the nose and over the mouth, and also that we wash our hands, watch our distance, and certainly stay away from crowds, and do everything we can to help fight this pandemic. And with that, Governor, I just want to thank you again, and I want to say that we are really hopeful that we are going to continue to be able to get that vaccine supply so we can increase the number of Washingtonians we can vaccinate on a daily basis.
Great. Thank you, Doctor. Thanks to your team. I saw Michelle Roberts in action today at the Max Vaccination site. I think it's great that we're working with so many local partners, including those who are working diligently to get this vaccine to hard-to-reach communities, BIPOC communities, those living in poverty. I talked to Dr. Chen today that they've worked with 40 organizations in Pierce County to make sure that we get everyone access to these vaccines. That work is going to continue. With that, happy to stand for questions.
First question for Dr. SHAH. I know you said the state is not leaving anyone behind, but there are stories across the country about the very specific challenges the elderly are facing with access because of lack of internet or transportation, or even just with other people. So is there outreach being planned for the seniors as more people become eligible? And then for the governor, back to your comments on the importance of in-person learning, I'm sure you know that the teachers union in Seattle last night voted not to return to the classroom. What's your reaction to that, and what role, if any, should the state play to address teachers' reluctance to go back to in-person learning?
Doctor, you want to go first?
Sure, Governor, thanks. So yeah, you know, I would say there are a few things that we've already been doing and we're continuing to do, and really also leaning on our local partners who are, again, are just really doing just an amazing amount of work on the community level. So the first and foremost thing is the outreach. In fact, this week coming, I'll be doing a town hall with AARP to really continue to underscore the importance of outreach to our seniors. We recognize that, you know, tech savviness, actually, to be honest, even I'm not so tech savvy. And I will tell you, there are times where we know that with online appointments that it is difficult. And so really making sure that we have redundant systems so that it's not just online or electronic, but also telephone. You pick up the phone and you can call, or it's a community member or a community group that's helping seniors navigate the system. We're also doing everything we can to make sure that we continue to emphasize to our partners, as I just did, to make sure that senior outreach as well as having appointments for seniors is also in the mix. And so there are a lot of things that we're doing, there are a lot of things that we have done, and there are a lot of things that we are going to continue to do. The last thing I would say is that in our VAC Center, we actually, some of the public-private partnership is also looking at how we can streamline some of these processes and make it easier for the experience for Washingtonians. And some of that even includes taking a page from those seniors who have actually gotten on Facebook in a number of different ways and places to actually get information to their friends and family members so they can help us also champion the messages. And we want to learn from them as well. So that is exactly what this is about, is continuing to stay ahead of this, continuing to evolve, and also recognizing that we're all in this together.
Rachel, I'll mention several things in answer to your question. There's several things that we really do know. A lot of things that are uncertain in life, but there are some certainties. One of the certainties is that we know that thousands of our children, our most precious assets, are in desperate conditions right now. They are in desperate conditions because they are cut off from the magic of in-person teaching. And some are doing quite well, some are doing okay, but thousands are in very difficult situations because they may not have as good a connection as they like. It may be because they have more challenges in the learning environment. They may have language challenges, and all of them face the difficulty that even with the best teacher in the world, there is a magic of in-person learning that can't be replaced. Now, I want to say this. I have seen some of the most brilliant teaching I've ever seen, and I've been an advocate for teachers for a long time, that I've ever seen of teachers doing remote learning, including with 3 of my grandchildren who have been remote and now are back on site, and they say it's awesome to be back on site. But what I've seen is educators who have been so innovative, so dynamic, they have torn their hair out trying to keep the attention of these 8 and 9-year-olds to keep them focused on their learning. And I've seen that firsthand, and I deeply appreciate the courage and hard work of these teachers of what they've been doing. But there is a certainty, which is that our children are having learning loss because of the difficulties of remote learning. We also know that thousands of parents desperately want their children back into on-site learning. This is a certainty. Not all parents. Many parents prefer remote learning at this moment. And so we have a certainty that thousands of children are suffering. Thousands of parents want their children back in school. Many parents would like their children to remain in remote. And all of those things can and should be accomplished together. That's the first certainty. The second certainty we have is that this can be done safely for teachers. And I want to take just a moment to talk about this because this is central to this situation. It is entirely understandable that educators, bus drivers, cooks, nurses, counselors have legitimate concerns about this disease. It is a potentially fatal disease. That's really understandable. And when we made decisions early to close our schools and go remote, we were operating in a very much a vacuum of information. I believe we now need to make decisions based on what we know now, not what we know then. And what we know now is that we are fully capable of doing this in a safe basis. And the reason is because we have over 1,400 schools doing that today with minimal, very minimal in-school transmission. In fact, to my knowledge, we luckily have not had an educator be hospitalized as a result of the disease that we are aware of. And the reason we've been successful is because we have found a way, because of the talents of educators, to have children wear masks. And when I've gone around, the compliance with masking has been super impressive on children and educators. Having space, having reasonable things in ventilation, and teachers and school custodians have found a way to deal with ventilation in old schools and new schools to make these safe. Now, if I can just share a little personal perspective on how I look at this. I'm from a family of teachers. My father was a very beloved teacher, coach, and counselor at Garfield and South High School. My brother is a retired art teacher in the Bellingham area. My brother and sister-in-law are retired teachers in East Wenatchee, in the Wenatchee area. And I can tell you, I would never send a teacher into an unsafe working condition. I would never do that. I would never do that for anyone, but particularly when thinking of my brother or my father or my brother and sister-in-law. And that's how I think of this issue. But I would have no hesitation on this green earth to ask my brother to go to work today in a school building that had these protocols of the nature that the schools have been using to date. And that's how I look at this issue. Now, we do have to follow these protocols. We do have to have a way to do contact tracing in schools, a way to ensure we have good rules of compliance with masks. And these 1,400 schools have figured out a way to do that. So my role in this, since I don't control these school districts, these are local decision-making by and large, is to share information with the larger community. And the information I'm sharing with you, I hope, will provide over time additional confidence on how we can get this job done. Fundamentally, this is a challenge between fear that is very human, and we all understand that, and confidence, which also is very important in our community. I think there's a reason that the information I'm sharing will hopefully give people more confidence. And certainly now that teachers have access to the vaccine, which they clearly have asked for repeatedly, I would hope would give them an added measure of confidence as well. But as the CDC has shown and the evidence has shown and our own experience has shown, we have a way to do this safely already. So I'm hopeful that people will continue to work together, be mindful of the challenges we have, listen to their critiques that each side will make at the bargaining table, and let's find a way to get these kids have another option.
Governor, the timeline that you put out today, you said is assuming trajectories for vaccine doses hold. Is that based off of vaccine doses that you've already been promised by the federal government, or is this just your estimate of what you hope will arrive in the coming weeks?
Well, it's based on the estimates of what the federal government believes they will be able to deliver. And it's a combination of what the manufacturers have told us and the White House team and our own estimates of our own experience throughout this pandemic, a combination of those things. I feel pretty confident that the supply chain will remain as we have estimated. The Biden administration has been very transparent with us. They have come through, and I very much appreciate that. There's no reason they've given us to doubt this particular supply chain. So I feel pretty good about these dates. And I'm really happy to be able to share them with people.
Governor, previous governors have stepped in to help districts such as Seattle to personally go there and get both sides back to the table. Why aren't you stepping in some fashion to try to get Seattle and other districts that aren't back to in-school learning?
Well, I have had conversations with both sides of the bargaining table. And if I felt that that would be helpful, I would do so. To date, that is not indicated by the parties. And you can be assured that I've been having conversations with both sides of those parties in the hopes that the confidence that I believe we should have can come to pass. As recently as, well, yesterday or the day before, I've been involved in conversation with educators and their representatives. I'm in communication with the superintendents and principals and otherwise, and I'm traveling around the state. So if that becomes something that I believe would be helpful, I could do that. At the moment, if the parties don't think it would be helpful, we want to do things that actually will be helpful. But look, generally what we think is helpful is helping people build confidence. That's what's really helpful. In order to go back to the classroom, both parents, educators, staff need to have confidence. And I believe there's every reason to have that, and I've seen no reason why we should not have that confidence. That's what's really effective here, and we are making progress. We've seen in the last several days various districts expand their on-site learning. I think in some conversations, people who ruled it out as recently as 48 hours ago will be rethinking that, I hope. So there is cause to think that our confidence is building. And my gosh, now that this vaccine is available, I don't believe it's too much to expect that we will redouble our efforts to get back to school.
Hi, yeah, I have a question, kind of a follow-up to Rachel's about not leaving anyone behind. And the directive for teachers on Tuesday, it was mentioned that they should use the federal pharmacy program to get vaccinated. Is that still the plan? And if so, how is that working? Because it does seem like we've just seen some tech-savvy teachers go online and get appointments immediately, which may be cutting in front of some of the other people who are still eligible and waiting for appointments.
Dr. SHAH, you want to address that?
Yeah, that is the challenge, right? When you have the seniors in 1B1 and now we have educators that are also in 1B1. And well, one thing that the governor said, which I do want to underscore, is that if you remember, we had originally thought that we were going to try to get to about 50%, and we would then take a reassessment of where things are. And that's one of the reasons why we are continuing to move forward with seniors in the 1B1 category. So we're still, 2.5, 3 weeks away from that date that the governor mentioned. And yet the reason we're doing that is we want to be absolutely as much as possible to get as many seniors vaccines and vaccine appointments as possible. It is true also that one of the announcements from the Biden administration this week was that it wasn't just that they were saying educators, or actually in particular teachers, to get at least one dose of vaccine by the end of March, but they were also saying that states could lean on the federal pharmacy program. And we do believe that the federal pharmacy program will take a lion's share of the teachers or the educators that are needing or wanting to get vaccinated. And the federal system is also working to make that happen. That said, we do recognize that there are vaccines that we're going to need to be bringing to the table in addition to the federal pharmacy program. But again, at the end of the day, we have to continue to prioritize all the groups that are in the priority groups thus far. And then we do believe that by the 22nd, we'll be able to move, if everything goes as anticipated, to be able to open up to other essential workers and those are at other risk.
Hi, Governor. I'm hearing from multiple parents from large school districts who are being told that the 6-foot distance requirement is what is stopping their schools from opening. And they're wondering if there's anything you or DOH can do to get L&I to offer some flexibility. Also wondering if someone can remind people how long all 3 of these vaccines last.
Why don't you take the vaccine question, Dr. SHAH?
Yeah, so there's a lot on the vaccine side that we continue to watch when it comes to the length of immunity that you get from it. And in general, we've been saying that we're anticipating about a year, give or take. Obviously, every immune system is a little bit different. We may be getting to a point, for example, next year where this starts to become almost like the annual flu vaccine. We don't know if that's going to be the case, but that's what people are thinking, that, you know, behind the scenes, that if we continue to be able to protect people in this next, where we've been over the next few months, where we've been and where we're going with the next few months in terms of waves, if there are additional ones to protect people, but then also to be in a situation where if it looks like immunity, long-term immunity starts to wane, then we may need to have an additional consideration for additional vaccination. So that's the main thing. And Governor, if I could just make a quick comment about the 6 feet and from the school standpoint, we continue at DOH to look at this. You know, we are concerned, obviously, that if you have especially kids that are at 6 feet and they kind of fudge a little bit, now it's 5 feet or 4.5, 5 feet, that's one thing. But if you're at a lower number, like a 3 feet, and something changes, that also puts then the people that are within that school system at risk. So we continue to follow the CDC guidance. We're continuing to look at the science and the evidence. We're also looking at what's happening across the country and across the globe, to be frank. And right now we continue to believe that 6 feet is the safest way to be. And that's what we're recommending from a Department of Health standpoint. But again, we're continuing to monitor the evidence that's out there.
If I had a nickel for every excuse I have heard from not giving our children on-site instruction, I would be a millionaire at this point. These excuses are getting just a little bit tiresome, frankly. We know that we have 1,400 schools today in the state of Washington, urban and rural, east and west, rich and poor, bilingual and monolingual, and 32 lingual, that are doing this today with these existing rules. And yes, it is difficult. It is logistically challenging. It takes people to cooperate with one another, but we know all of that can be done effectively. And as a result of those efforts by educators and superintendents and principals, this can be done. And this is the CDC guideline. It is a safe approach. Will we ever change it? There's a possibility. As we know more about science, as vaccines become more prevalent, as perhaps we start to knock down the infections. But today, we have two certainties. Our children are not getting the education they deserve, and we know we can provide it within the existing guidelines because we are doing it in so many places across the state of Washington. And I am asking, and Washingtonians are asking, everyone in these communities to dig deep a little bit and get in touch with a solution-minded mindset. Because once these communities have started looking for solutions, they have found them in Spokane and Moses Lake and Puyallup and Elk Ridge and Stevens, where they speak 32 languages in Spokane. We can do this.
Today, Republicans in the state legislature put forth their version of what they want to see for reopening, which included things like decision-making at a county level, moving businesses to 50% capacity and then 100% capacity 3 weeks later if there's no spike in cases. As these sort of plans come out here and elsewhere, I think I would just like to hear from at least Dr. SHAH, maybe the governor, on responding to those sorts of proposals, specifically that proposal in Washington, and then explain why that's not the direction you're taking.
We are not following the leadership of Texas on this because we have saved perhaps 11,000 people by following science about what will protect our people, and we will continue to do that. Dr. SHAH, is there anything you'd like to add?
Well, you know, I've been on the front line for this entire, 2020 in local health, and as Governor mentioned, in Texas. And I'll tell you, it is extremely difficult from a public health standpoint when, you know, all of our public health folks on the ground are trying to do everything they can. And then you start to see potentially peeling back of those exact strategies from a state standpoint or overall population standpoint that makes it hard for people to protect community members. And so, I come from that perspective, and, I apologize for being so public health, pro-public health and pro-public health from that vantage point, but that's exactly why we continue to make sure that we are careful, we're safe, we're doing this with, as the governor said, we know that we just passed this sad milestone this week with 5,000 Washingtonian deaths, and yet we also recognize that it could have been markedly more if we did not follow the guidance and follow the preventive measures. And so I guess I have this public health bias as I respond to that question, where I really feel that we need to make sure we're doing everything we can to protect from a public health standpoint.
And building on the governor and Dr. SHAH's remarks, I would add that as the governor announced recently, we are in the middle of an effort where we're meeting with local elected officials, business leaders, public health folks to solicit input on where we go from here and how we add additional reopening into our plan. But we have to do this in the same way that we have to reopen and finish this out the same way we went into it, with the same caution and the same concern for saving as many Washingtonians' lives as possible. And our efforts, as the governor mentioned, have saved 11,000 Washingtonians. And so we're going to continue to be cautious, but we do see hope on the horizon. We are going to continue to work with those stakeholders on our reopening efforts, and I'm sure we'll have more to share on that in the future.
Governor, most districts in Snohomish County have gone back and resumed some in-person learning in the elementary grades, but also most of them have not begun any discussion or made any efforts to do the secondary grades, and in particular high school. And given everything you said today, and given the vaccine doses are coming, are you expecting in the districts to try and bring secondary students back before the end of the year, knowing that it does take them 3 or 4 weeks to get started? That only leaves them 3 or 4 weeks to have them in the classroom.
Yes, we are expecting that, because it is a reasonable expectation when we have demonstrated the ability to do this across the state of Washington in dozens of middle schools and dozens of high schools. This can be done when people put their minds to it. And it is not a matter of months, it's days or weeks. And we have time to do good things here. And every single week is a week an 8th grader doesn't get back in their life. So yes, we do have that expectation, and we are asking people to dig deep, get in touch with their confidence, get in touch with the current science, and ask themselves this question: if they can do it in Spokane and Puyallup and Elk Ridge, why can't I do it? And if they really can't come up with an answer to that, we're asking them to dig deep and help these kids have the most precious thing in their lives, because you're only 12 years old once in your whole life. And we're going to try to do some things to remediate some of the learning loss that these children have suffered. But it's better not to lose it in the first place. So we are asking people in this regard, and I think they will amaze themselves what they're capable of doing. I do think this idea of starting in the elementary schools has been a wise one, because those children need it the most, of course, but it also is a confidence-building exercise. What I have learned here, and I've gone to quite a number of schools, as you know, is that there is enormous trepidation about this when this discussion starts, for understandable reasons. It is understandable that people are nervous at the outset of going back into a classroom with 15 children. And most of these are hybrid programs, as you know. In fact, I remember talking to a math teacher, I believe it was at Elk Ridge Elementary School. He was a high school teacher, actually. I think he was a union rep. And he told me, look, I had real doubts about this idea of going back on site after they'd been remote for months. But he said he went over to Yakima and he looked at what they're doing at a high school in Yakima, where they had a hybrid model, so you reduce the people in your hallway in half. And he said all of a sudden it just kind of light went off that when you have that much room, you can be a lot safer environment. And he came back and now it's working really well. And so what you find is that when people see and experience success in the elementary grades, it helps build confidence in the upper grades. but we don't have a lot of time, so we need people to get in there and start planning and getting this job done right now. That confidence will follow, and it has. Here's an interesting thing, I think, when we talk about this issue. There's been 1,000, I think, 400 schools that have gone back to some degree of meaningful multi-grade education. To my knowledge, there has not been one single school, I could be wrong, but to my knowledge, that abandoned this and went backwards. And the reason is because they have seen it work. Not one, to my knowledge. This is something that should give us confidence. And we owe our kids a little confidence here, I think. We owe these kids this. And I'm expecting people to give that level of confidence to our professional endeavors. And I'm looking forward to that happening.
Hello, I'm here. Can you guys hear me? I'm sorry. It seems
Yes.
like I have technical difficulties.
Yes, we can.
Okay, thank you so much for taking the time, Governor. I really appreciate it. We're just questioning or have a question about, vaccines and allocations. Obviously, you've heard a lot of people say that they are having a hard time getting their vaccine. We're now seeing Facebook pages pop up that are now helping people to get the vaccine in their area. What do you say to that? Some people are a little frustrated that they're having to turn to Facebook instead of their own state Department of Health to get the vaccine and find out where vaccines are available.
Well, what I would say is this frustration is both understandable and inevitable because we have 7 million people and we're, getting 100, 200,000 doses a week. So to some degree, we have to understand all of us are going to be anxious and frustrated that we can't all get the vaccine today. This is just a reality we have to face. But I would also say that our department is continually upgrading the ability to share software to make it easier for people to find it. They do now provide advice on the software about where allocations have gone. And we don't have a centralized system because we don't have a single payer healthcare system in this country or this state. So you have literally hundreds of different entities that are making their own appointments for folks by necessity because they're standalone operations. They're not run by the Department of Health. So at the moment, what we're doing is the best we can do, which is to tell people where those allocations have gone, and people contact them through multiple channels to find out if in fact they have doses. And we're continuing to see if there's a way to integrate that better. And I want to thank those people on those Facebook pages and others because we've had some volunteers go out and try to coordinate some of these through their own mechanisms. And we have brought those groups into the Department of Health to expand some of those operations. So I hope that this is going to be easier for people as these doses increase. I will say one more thing, and this is hard to say, but it's the truth. This is a miracle today that we have vaccines. It is a medical miracle. And if you'd ask anybody from Fauci to Dr. SHAH or me, if we were to be in this place to have 3 vaccines that can save your life, it's a miracle. Dr. SHAH, you want to talk about this issue?
Well, and also the fact that, we've already administered, 1.7, 1.8 million vaccines and counting. So, I agree with you, Governor. I think Lacey's camera came on, so it sounds like Lacey wants to say something, but I did want to recognize that as I made my earlier comments that we are incorporating any of those strategies when we are seeing some that work well. We're also working with our partners as part of our VAC Center, including with Microsoft and others, to really expand that experience, that it makes it easier for people when they come onto the DOH website to not just navigate it, but also a positive experience in being able to figure out where vaccines are. But the governor is absolutely right. We have 300, 400 vaccine providers. It's only a quarter to a third of all the vaccine providers who've signed up because we don't have the vaccine supply. So really bringing all that together is a challenge, but that's certainly is just an explanation, not an excuse. I always feel like we need to continue to do better by our communities, and that's what we're going to continue to do as a DOH. I think you want to say something, I know.
Just quickly to build on Dr. Shah's comments, our private sector partners along with our IT staff at DOH have been making iterative improvements to the vaccine locator tool, which Dr. Shah and the governor mentioned. So that is on our website. They are using what's called screen scraping technology, and we get data from our providers. So, it not only tells you where we ship vaccines, now we are trying to show where there still are appointments available. Now, that information changes quickly, and sometimes if you don't grab the appointment immediately, you might get to a dead end. We're working to have more real-time direct interfaces with these providers. So just making iterative improvements so that this is a better customer experience for all of Washingtonians. And, for anyone out there seeking a vaccine that's eligible, keep trying. If you know someone that's seeking a vaccine, help them. We know it's challenging. We know it's frustrating. We are trying to make it better for you, and we want you all to have a vaccine.
One other thing I should note is that we're trying to make these appointments available to folks who don't have computer skills or not comfortable. So we are in many of these MaxVax sites reserving a certain number of appointments to be made by phone, because this will allow other, folks who are not computer, friendly. And this is important to get access to underserved communities. That does make it a little more cumbersome to make the appointments, of course, because we can't totally use some of this software. But it is a good idea, and I'm glad that we're doing it. I will tell you this too. Look, we're Americans as well as Washingtonians, and I can tell you there's 50 states that are facing these challenges. We're not the only ones who are facing these challenges.
Hi, Governor. Two questions. We're doing a story next week about looking back at the first month or two of this pandemic in the U.S. and Washington State. What was it like for you? Can you remember your thoughts or any feelings in those first days, those first weeks, that first month as COVID first started spreading? And second, a year on, reflect on how this pandemic has played out differently or similarly than you thought it might in those early days.
Well, I know we were greatly concerned, but I had confidence that Washingtonians would rise to the challenge, eventually follow science, mask up, socially distance, obey our rules, and as a result, we would save 11,000 lives, and within a year have 3 vaccines that can save tens of thousands and more. And verily, it has come to pass, because that's what we've done together, and it has been, frankly, an outstanding achievement with all the losses we have suffered. And I'm so proud of Washington for what we've done. Now, I wish I could tell you that's totally true, because I didn't know all those things. But I did have confidence in our state. And that's why we were one of the early movers to take early action against this pandemic. And that early action, I think, had some considerable success. And it is why I have been willing to make controversial decisions that have not been universally accepted, but have been conclusively beneficial to save lives. So that's about as far back I'll go in the retrospectroscope.
Governor, just going back to the decision to expand eligibility to include K-12 employees, it was not that long ago that you said that you do not believe that 25-year-old teachers think they should get in line ahead of their 80-year-old grandparents. Given that there are still 50% of the 65-plus cohort waiting to get a vaccine, why did you make this decision in the wake of the new president's directive? And I imagine, I'm imagining, had it been the previous president, you might have told him to go pound sand. We're doing it this way. We're on our time schedule. We're not changing. Why did you change?
I didn't make the decision, Austin. The President of the United States made the decision, and he issued a legally binding directive to all states, including mine, and I followed the law. unlike the last president, who frequently did not follow the law, thank you very much, including causing an insurrection to try to stop the election of this president. So please don't compare me to that nameless person. Gets my dander up, as you can tell. No, this was a decision by President Biden. I disagreed with it. I thought it was imperative that we keep access to these vaccines to the group that's in the most dangerous category, and that's older folks. I also believe that it was good that when we did move towards the next tranche, that we would have the same level of respect for agriculture workers and grocery store clerks and bus drivers as we did for educators. And so we had them in that same grouping. The president made a different decision, and he issued a directive, and we followed it as we should, and we're constitutionally bound to do that. Now, I am hopeful that this will have the beneficial impact of giving educators more confidence going back to teach in schools. I hope it will have that benefit. Now, we were going to be putting the teachers would have, we were actually, what's today, Thursday? We were going to announce, probably, it wasn't totally final, that teachers would be eligible on March 22nd anyway, along with these other tranches that I announced today. So the president's directive essentially advanced teacher access about 2.5 to 3 weeks. It was a different decision than I would have made, but I respect the president's decision. I know he had tremendous motivations in doing it. And by the way, I think he's been doing a fantastic job as president. And I will also say I'm thrilled that we're getting more doses, which is the solution to this problem, is more medicine. And we're getting it because Joe Biden has had the gumption and the leadership capability and the basic competence to get more orders into these manufacturers. And our access is going up by hundreds of millions of doses, above what the previous occupant of the White House had even bothered to negotiate. So I'm thrilled by what he's doing on this vaccine. Nope, I want to thank everyone, and please be well and enjoy the daffodils are up. The daffodils are out in Puyallup, and the max vaccinations are too. So it's a good day in Washington State. Good luck.